Please join me for Ask the Good Doctor, live today and every Wednesday at 1 p.m. Eastern Standard Time, 12 noon Central Standard Time, and 10 a.m. Pacific Standard Time. Bring your questions.
It's Wellness Wednesday. I'm Dr. LaJoyce Brookshire. Welcome to Ask the Good Doctor. I am here to help you attain, maintain, and reclaim your perfect health. So please like, comment, subscribe, and share. We are so glad you're here today. Grab your Good Doctor notebook. This is installment number 2 of the series that we have with Dr. Sam Shepard, a biochemical engineer. Welcome, Dr. Sam.
Glad to be here, Dr. LaJoyce. It's always nice to see you.
Always good to see you. You are such a chock full of information. And like I always say, you make sense out of nonsense. So that's why I wanted to have you here today, because there's a lot of nonsense swirling in the air. One thing that I wanted to really have you sink your teeth into for us to make some sense of is how to treat high blood pressure in men without them ruining their sex lives.
Yeah.
This is increasingly troubling. In fact, the European Society of Cardiology says that men with hypertension are almost twice as likely to have impaired penile blood flow and erectile dysfunction compared to men with normal blood pressure. We know that because it's a blood vessel thing. However, studies have shown that those with erectile dysfunction are more common in those who take the blood pressure medications, especially the hypertensive drugs, notably the diuretics and the beta blockers. And they have been linked with deterioration in sexual function. That's like a huge warning. What is going on?
Yeah, the diuretics and the beta blockers historically have added to erectile dysfunction. I guess we'd have to go back to the cause and effect of hypertension to loss of blood flow and damage to the endothelial cells inside the arteries. The hypertension itself causes a tremendous systolic flexing of the artery and the endothelial cells. As a result, and it's oftentimes a function of LDL cholesterol, which is like pumping sandpaper. That's the bad cholesterol through your arteries.
Yes.
The endothelial cells and epithelial cells of the arteries will become irritated, and you'll get an inflammatory response. In the small capillaries, and in some of the valves, with erectile dysfunction, you have venous valves that will close off.
Yes.
And the arterial vessels will expand, and that's what causes the penis to become erect. When you have hypertension, not only is there inflammation of the endothelial cells inside the artery where you can get plaque buildup, that manifests in those small capillaries where it goes from the artery to the vein. You can get a shut off there also. Now, but in the valving of it, those valves can regurgitate. They can be damaged to the point that when the valves are open in the veins, then they should flap shut and hold pressure back, and only open partially in the vein to hold back pressure into the penis that allows it to get to full erection. In a damaged cell, this happens. Now you have this huge gap that blood just races through. There's no back pressure in the penis. The penis will not become erect. Oftentimes, so that's what appears to be happening, is not so much in the damaged, although that's the start of it. That's where we usually see it, is either plaque formation or some sort of damage done to the endothelial cells inside the arteries. But if it's happening in the arteries, it's also happening at these valves. So where they're supposed to overlap and shut completely off, now they've been chewed away on the ends. So they just do this, and you
Yes.
can't maintain back pressure. I guess is the best way to do it. Back pressure into the penile tissue that allows it to maintain its erection.
You know, what's interesting is my couples are at their wits' end, because the wives, of course, they want their husbands to be healthy. They want to make sure that they are taking their medication, and the fellas are just at their wits' end because they know that their penile function is diminished as a response to taking these medications. Take a look at this video that Chris has for us.
Can your blood pressure medicine affect your erections? The answer is yes again. It's blood pressure medicine. It's typically meant to lower your blood pressure. And what do you need to have good erections? Good blood pressure. That's how you get an erection, with blood going in there, staying in there. And when you're talking about blood pressure medication, you have to be very careful with it. I talked to a gentleman who had been taking blood pressure medication for 30 years. And guess what? He no longer has erections. Why? Well, first of all, you are masking the actual issue. As I say all the time, if you're taking pills over a long period of time, that means the pills aren't working. You didn't go to your doctor saying, hey, doc, I'd like to have the same problem for the next 30 years. So what he should have been doing, and which I advised him to do, is to actually start looking at his pattern. What are the things he is doing? How much meat is he eating? Cut that back. How much sleep are you getting? Increase that. How much exercise are you getting? Increase that. All of those things are going to add up to you having better erections. If you're continuing to take the blood pressure medication, of course you're going to have problems. It's lowering your blood pressure. It's masking the issue. All of the insides of your veins is being worn down. That's causing so many other issues, and just having blood pressure medication isn't a good idea. So I hope that answers your question. Go ahead, check your patterns, make sure you're taking care of this, because it will become more of a problem later on in life. So
I love this video because this gentleman really succinctly states how the medication, while it does have its place, that there are a lot of things that an individual can do to combat high blood pressure. What say you about it, Dr. Sam?
Yeah, there's a lot of it's what's called auto acceleration, and the frustration that men go through, and especially the frustration when they see their mate totally frustrated. It sort of breeds on itself. So the higher the anxiety level, the more stressful they become, the higher the degree of inflammatory response, the higher that the endothelial cells become damaged. So you can get into this vicious cycle.
Yep.
And it becomes a mental game almost as much as it is a physical issue.
Come on.
Yeah. So the man's anxiety will increase, and he doesn't want to be put in a position of being, I guess, linking it to a sense of loss of virility.
Yeah.
And that anxiety, when that's experienced, changes he'll withdraw. His initiative to be proactive in the foreplay side, or the ability to pursue goes away, because he knows he's dealing with a lit match that may come back to bite him.
Ouch. Ooh, that's a mouthful. So true. Now, I always recommend, just like in the video, get more sleep, eat more vegetables, cut back on that pork, cut back on those sweets, decrease your inflammatory response in the body. And Do things that are good for yourself. Get exercise. I agree wholeheartedly with all of that, because that's how you prevent it as well. And when we speak of the circadian clock and defying nature, you cannot defy that clock. I don't care if you're taking herbals or medication. You can't stay up all night just because you don't work anymore. Or you
That's
can't stay
right.
up all night even if you do.
That creates a epinephrine, norepinephrine, and a cortisol release in the adrenal gland of the fight or flight reflex.
So wait, pause. Say it
Yep.
louder for the people in the back.
When you cause, especially in a loss of sleep cycle, we see it a lot, or a change in your sleep cycle. When that happens, your body, this is how mental, when your brain can't rest, it assumes, rightly or wrongly, that you're in a fight or flight reflex.
Yeah.
There's something stressing you out. And when that happens, the brain then sends signals to the adrenal gland to start producing three primary hormones, epinephrine, norepinephrine, and cortisol. You've heard of mothers picking up cars to get their babies out from underneath them. Yep. That's coming from the epinephrine, norepinephrine in the adrenal glands that gives them that strength. Well, there will be a price to pay the next day, because all of those hormones have to be processed in the liver, and you can't chronically do that and maintain good health. We see it in soldiers with PTSD, where they're in months, weeks, even years of conflict, and they're in a constant fight or flight reflex. It becomes a chronic disease state. And now we're beginning to look at this PTSD as an inflammatory response that becomes permanent.
Oof.
The chronic inflammatory disease can cause permanent structural changes in the brain.
Wow.
And the body is trying to adjust to that. So it's a pretty big deal. With the dysfunction, that's the mental component of sexuality, is that how do you deal with it when you know that this threat or perceived threat is hanging over you? There's a lot to fear in that regard. Yeah. And failure is not something that men deal with logically.
No, not at all. You've got a little something in your back pocket to help us. What is it that can be used for help? And you know what? Not only that, the sexual dysfunction is not just a diminished libido. Also, it's not just happening to men. It's also happening to women.
That's correct. It's been less studied in women. We've always linked that a lot of the libido is just hormonal, and we just sort of accept the fact that women's hormones constantly change. I just did a video on prostate cancer, and one of the main component that we now know we think is causing prostate cancer is what's called dihydrotestosterone. And dihydrotestosterone is produced from testosterone reacting with the hydroxyl free radical in the presence of an enzyme called 5-alpha reductase. When the testosterone is present, the stressor, the hydroxyl free radical, is present. So that's a measure of your anxiety. And we all have 5-alpha reductase as an enzyme in every cell. When those three come into contact with each other, they produce a chemical called dihydrotestosterone and peroxide. That's one of the other components. Well, dihydrotestosterone is what causes a loss of libido. It causes balding in men and women.
Wow.
And it increases the risk of prostate cancer. So in men, it's all testosterone driven because we have such a high concentration of testosterone. So there's three things that they can do to treat prostate cancer. You have testosterone, you have the hydroxyl free radical, and you have 5-alpha reductase. If any one of those three components are missing, your odds of getting prostate cancer go down dramatically. Well, it's very difficult to get rid of testosterone short of chemical castration or physical castration.
Mhm.
That's pretty extreme.
Yes.
The other one is the 5-alpha reductase. They have to give you a 5-alpha reductase inhibitor. When they do that, there's terrible side effects because it affects the 5-alpha reductase enzyme in normal cell production. It's needed there too. It's a hydrogen ion transfer agent, so it's needed throughout the body. If you
Wow.
give an inhibitor, it's going to affect other things. So that only leaves one, and that's the hydroxyl free radical. And that's caused from stress, oxidative stress inside our bodies.
Come on.
And this is why ValAsta is so important.
Tell them about ValAsta.
Yep. If we can knock out the hydroxyl free radical, then your odds of getting these types of cancers go away. It happens even with ovarian. Now, women are not producing as much testosterone, but they still have 5-alpha reductase, and they still have the stressor, the hydroxyl free radical. So you see women under stress will start losing their hair.
Yeah.
I can walk down the street and look at the crown of a woman's head and understand that woman is under tremendous stress.
Yes, sir.
That's what causes
it.
Now, the advantage is that when you reduce the level, because their testosterone level is lower, when you reduce the level of the hydroxyl or their anxiety, their hair will grow back.
How about it? Because you're giving the body what it needs.
That's right. And you're taking away the that which is damaging it.
That's correct. Listen, we need to just let this marinate, because that was an entire semester worth of science lesson, that right there. Thank you for breaking it down. We appreciate you so much. And we want to have one more session with you next week. Would that be okay?
That's fine. Perfect.
That'll be okay. So you stay right there. Thank you very much for being here, Dr. Sam. We appreciate you. And thank all of you for joining us as well. Don't miss next week. Dr. Sam will be back with another gem to drop on us. I told you would need that good doctor notebook. I want to thank DJ Indy, our announcer, Christopher Green, technical producer, IW, supervising producer. And remember to let your eyes shine. Cut back on the wine. Get good food fast and go easy on the greasy. Until next time, I'm Dr. LaJoyce Brookshire, here to help you attain and maintain your perfect health. Let's do it again next week, okay? God bless you.